Thank you for the chance to share some information with you about chiropractic without an appointment or the distractions of a busy office. Our short time together in this way can help you decide if chiropractic has a place in the achievement of your individual health goals. This and the many other educational tools we use in our office create an open, stress-free environment where ideal doctor-patient relationships can grow. Over the years, we've discovered that this partnership approach not only gets better results faster, but avoids the frustration of patients seeking our office for the wrong reasons. So, why do patients consult our office? Well, typically, patients see us because they have an ache or a pain or some symptom that they've heard chiropractic can help. And while chiropractic has given relief to millions, I'd like to share with you what happens in our office, what the doctor is looking for, and the decisions that you'll be asked to make after the results of your examination are explained to you. Most people consult our office with what they think is a back-related problem: headaches, stiff neck, back pain, tender muscles, even pain radiating down an arm or a leg. But chiropractic shouldn't be limited to back problems in the same way that medicine shouldn't be limited to stomach problems just because the prescribed medicine enters your system through the stomach. Interestingly, in a recent California survey, 90% of the patients surveyed not only were satisfied with their chiropractic care, but actually thought they had benefited more than they had expected. Many discovered other seemingly non-back-oriented problems cleared up too. How come? While chiropractors work with the spine, they are primarily concerned with the nerve system. Simply stated, the brain sends out messages which travel down along the spinal cord, out over the nerves, controlling every cell, tissue, and organ of the body. To make the loop complete, messages are then sent back to the brain. Since the spinal cord, protected by the bones of the spine, is the major pathway for this communication, leading authorities on spinal function tell us that if the spine malfunctions, the nerve system malfunctions too. Clearly, nerve system disturbances result in a loss of health, not just in spinal problems. Does this mean all conditions can be treated by chiropractic? Of course not. But when the function of the nerve system is improved, the body begins its natural healing process. So just what can you expect when you enter our office? Imagine a 45-year-old male who has hurt his back a couple of weeks earlier, calls for an appointment, and enters our office. First, we review his total health history. Had there been any other problems? How long has he had them, and that sort of thing. Next, we perform a comprehensive physical, chiropractic, and X-ray examination. The results not only tell us what's wrong, but if chiropractic can help. Remember I mentioned that an open educational dialogue with our patients seemed to create the most effective doctor-patient relationships? That's accomplished largely by educational materials and short, informative, fun-to-watch video presentations. This information equips our patients to better understand their X-rays, the report of findings, and make decisions about what type of care they want. Usually, our patients begin initial intensive care, first to provide temporary relief of symptoms, which may take a few visits to a few weeks depending on the problem. The second stage of initial intensive care is to stabilize the spine to prevent the problem from immediately reoccurring. Relief and stabilization may last from a few weeks to about 16 weeks, again depending on the age, lifestyle, and individual response. At the conclusion of initial intensive care, we'll perform a progressive examination. Usually, at this stage, our patients are feeling better, and their original complaint is only an unpleasant memory. So why then do a majority of our patients continue care? Well, here's why. One of the most important examinations we perform is the spinal subluxation degeneration study to determine the severity of spinal malfunction. We know that from the back, the spine should appear fairly straight, and from the side, 4 basic curves should be present. This allows each vertebra to move freely and function properly. But what if this normal spine is traumatized by a childhood injury, an automobile accident, or dozens of other possible causes? This damage often results in something called the vertebral subluxation complex. Vertebral meaning the spine. subluxation, meaning less than a major dislocation, but definitely not normal and causing spinal malfunction. And complex, meaning consisting of more than a single component. In this case, there are 5 components to the vertebral subluxation complex. The first describes the movement of the spine itself. If there are vertebrae that are not moving properly and are stuck or fixated, the vertebrae above or below this problem compensate, usually becoming excessively mobile. This often produces scoliosis and changes in the normal curves. This component is called kinesiopathology. This spinal malfunction affects the nerve system by either a vertebra directly pressing on nerves, biochemical toxins, or frequently by nerve tissue being pulled or twisted. As expected, this affects the body function controlled by these nerves and is referred to as neuropathophysiology. The third aspect is the effect on your muscles, either causing spasms, tight muscles, or degrees of paralysis, weak muscles. And this is called myopathology. There are also changes in the soft tissues, like discs, that can degenerate, or ligaments that can become stretched or torn with swelling and inflammation. And this is called histopathology. And finally, we see changes to the spinal bones themselves, as the body builds up calcium attempting to fuse adjoining bones to stabilize the weakened spine. This pathophysiology of the spine produces irreparable damage. X-rays show this condition clearly. This process we're going to see can happen anywhere in the spine. This example happens to take place in the neck. Here's a textbook example of a near-normal cervical spine. Notice the forward curve. The equal disc spaces between each vertebra and the edge of each bone is smooth and uninterrupted. Let's say this spine is traumatized by falling off a bicycle as a child, a sports injury, or a job-related accident. The spine degenerates into phase 1. In this case, a backward displacement. But the discs have not yet begun the process of degeneration. This misalignment and malfunction without recognizable tissue degeneration usually takes about 20 years of neglect, often without significant pain, before worsening into phase 2. Now we have misalignment, malfunction, and tissue degeneration. Typically, there is disc narrowing and now calcium buildup. If the original problem remains uncorrected, we will see the evidence of phase 3. In phase 3, there is now bone fusion and permanent soft tissue degeneration. This process continues until destruction of the bones and nerve system has occurred, going from a simple, easily corrected problem to an irreversible condition. The time frame may vary, especially if there's further trauma to the spine. But one thing is certain. Once the process of subluxation degeneration is set in motion, it goes to completion, unless the process is interrupted. That's what chiropractors do. So how's our 45-year-old male doing? Typically, we would expect to find him in phase 1 or phase 2 of subluxation degeneration. After a few weeks of initial intensive care, he's feeling better. But what about the years of spinal degeneration? The next stage of his care is to slow, stop, or even reverse subluxation degeneration. This process towards complete spinal corrective care is called rehabilitative care. The length of time varies from a few months if you're in phase 1 and longer in the more advanced stages of phase 3. And what are your chances of recovering? Well, it ranges. In phase 1, a complete return to normal is usually expected. In phase 3, stopping the process from getting worse and allowing some healing is significant and important. And our 45-year-old male patient? He entered our office here with a back problem and years of frequent headaches. During our examination, we found portions of his spine in phase 2 of subluxation degeneration. At this point, he had 2 choices. The first was to discontinue care with his symptomatic picture cleared up. In his case, relief and stabilization care, even with years of neglect, was complete in just 16 weeks. The other option was to continue with rehabilitative care. This decision was totally up to the patient. with our responsibility merely to share the clinical facts and support patients with whatever decision they make. Later, an additional type of care will be made available, called maintenance care. And while adults who have experienced the effects of years of subluxation degeneration may not be immediately presented with this option, our office has many children receiving this kind of wellness chiropractic care. And that's what we do. If you're interested in the natural approach to relief, and if the information I've shared with you makes sense, we'd like to help. If you're looking for a contemporary, preventive wellness approach to health care, and you want to learn and participate in decision-making about your health, we'd like to get to know you. And if you're looking for quality, service, and a professional experience based on mutual values, let's get together. Call our office. We look forward to hearing from you.